Okay, so now we're on the second disease of the gastrointestinal tract, which is peritonitis. First, let's look at the peritoneum and see what a normal peritoneum would look like. We see here the figure, which the digestive organs are withheld in the abdominal cavity by the peritoneum, which is a broad serous membrane sac made up of squamous epithelial tissue surrounded by a connective tissue. It is, composed of two different regions, the parietal peritoneum, which lines the abdominal wall, and the visceral peritoneum, which envelopes the abdominal organs. The peritoneal cavity is a space bound by the visceral and the peritoneal surface. First, let's look at the peritoneum and see how it normally functions and what exactly is it. The digestive organs within the abdominal cavity are held in place by the peritoneum, which is a broad serous membrane sac made up of squamous epithelial tissue surrounded by connective tissue, which we see outlined here in the green. It is composed of two different regions, the parietal peritoneum, which lines the abdominal wall, and the visceral peritoneum, which envelopes the abdominal organs. The peritoneal cavity is a space bounded by the visceral and parietal peritoneal surfaces. A few millimeters of watery fluid act as a lubricant to minimize any friction between the surfaces of the peritoneum. Let's look further into the visceral peritoneum here. We can see it outlined in a side profile here in the figure. The visceral peritoneum includes multiple large folds, as we see here, that envelope various abdominal organs. It holds them to the dorsal surface of the body wall. Within these folds are many blood vessels, also lymphatic vessels and nerves that innervate the organs with which they are in contact, supplying their adjacent organs. The five major peritoneal folds are described in the next chart. During fetal development, certain digestive structures, including the first portion of the small intestines called the duodenum, the pancreas, and portions of the large intestines, remain completely or partially posterior to the peritoneum. Thus, that is why the locations of these organs is described as retroperitoneal. Here are the five major peritoneal folds that we discussed in the previous slide. We have the greater optimum, the falciform ligament, lesser optimum, mesentery, and mesocolon. Here you can read the description of what they do and where they're at within the Okay, so our disease of the gastrointestinal tract starts here, the peritonitis. It is actually inflammation of the peritoneum, which we went over, and it is called peritonitis for that reason. Chemical peritonitis can develop anytime the wall of the alimentary canal is breached, which allows the contents of the lumen entry into the peritoneal cavity. For example, when an ulcer perforates the stomach wall, gastric juices spill into the peritoneal cavity. Hemorrhagic peritonitis occurs after a rupture of the tubal pregnancy or traumatic injury to the liver or spleen fills the peritoneal cavity with blood. Even more severe peritonitis is associated with the bacterial infections we see in appendicitis, cholinergic diverticulitis, and pelvic inflammatory disease, including infection of the urinary tubes, usually by sexually transmitted bacteria. Peritonitis is a life-threatening emergency and often results in emergent surgery to correct the underlying problem with extensive antibiotic therapy. When your great-grandparents and even your parents were young, the mortality from peritonitis was very high. Aggressive surgery, improvements in anesthesia safety, and the advance of critical care expertise with antibiotics have greatly improved the mortality rate from this condition, but even so, the mortality rate still ranges up to 40%. The symptoms of peritonitis would be fever and chills, severe abdominal pain, some bloating, maybe a distension or so of the abdomen, nausea and vomiting, and diarrhea. But this is a life-threatening emergency which requires immediate assistance with medical care. There are two different types of peritonitis. One is secondary, which we see here. This is caused more so by a disease in the digestive tract, such as Crohn's disease or diverticulitis. It can be also caused from an ingestion of a sharp foreign body, such as a toothpick, fish bones, or glass. It requires an invasive medical procedure usually, which involves the securing of the ruptured um, organ or structure, and also removal of the foreign body. It can also be caused by some invasive medical procedures, including peritoneal dialysis and tube feeding. Also, an aneurysm of the abdominal aorta can rupture, as we see here in the figure. Spontaneous peritonitis occurs as a second cause of peritonitis, and this arises from an infection which builds fluid up in the abdominal cavity. This could be caused by cirrhosis, severe long-term chronic disease of cirrhosis. Also, this happens when non-infectious leakage of body fluids in the peritoneum occurs, such as blood, gastric juice, urine, or bowel.